You're tired all the time. You can't seem to lose weight no matter what you do, and you're constantly craving sugar and carbs. Your doctor says your blood sugar is fine, but something still feels off. What if I told you that you could have insulin resistance for years, maybe even decades, before it shows up on standard blood tests? And by the time it does, the damage is already done. Hey everyone, I'm Dr. James Mitchell, a nutritionist who helps people balance their blood sugar, improve their metabolic health, and understand their bodies on a deeper level. And if you watched my last video on lowering blood pressure naturally, you already know that insulin resistance is at the root of so many chronic health problems. Today we're going to talk about the 13 red flags that your body is screaming insulin resistance right now, even if your doctor hasn't diagnosed it yet. Here's the thing that drives me crazy. Most people think insulin resistance means you're pre-diabetic or diabetic. They think it's all about blood sugar. But that's missing the entire picture. Insulin resistance starts happening in your body long before your blood sugar becomes abnormal. Years before. Sometimes 10 or 15 years before you fail a glucose test. And during all that time, insulin resistance is quietly destroying your health, increasing your risk for heart disease, stroke, Alzheimer's, cancer, fatty liver disease, hormonal imbalances, and so much more. The biggest misconception about insulin resistance is that if your fasting blood sugar is normal, you're fine. This could not be more wrong. Let me explain why. When you eat carbohydrates, your blood sugar rises. Your pancreas releases insulin to bring that sugar down and shuttle it into your cells for energy or storage. In a healthy person, this system works beautifully. A small amount of insulin does the job efficiently. But when you're eating a high-carb, high-sugar diet repeatedly, day after day, year after year, your cells become overwhelmed. They're constantly being bombarded with insulin, telling them to take in more glucose. Eventually, they start ignoring the signal. They become resistant to insulin. So what does your pancreas do? It makes more insulin. If the cells aren't listening, the solution is to yell louder, right? This is called compensatory hyperinsulinemia. Your pancreas is producing massive amounts of insulin to overcome the resistance and keep your blood sugar normal. And here's the key point. For years, maybe decades, this works. Your blood sugar stays completely normal because your pancreas is pumping out enough insulin to force it down. Your fasting glucose test comes back at 85, and your doctor tells you you're fine. But your fasting insulin might be 20 or 30, which is dangerously high, and nobody checked it because it's not part of the standard panel. During this entire time, that excess insulin is wreaking havoc on your body. Insulin isn't growth hormone. It tells your body to store fat, especially around your belly. It promotes inflammation. It damages your blood vessels. It disrupts your other hormones. It increases your risk for cancer because cancer cells love insulin and glucose. All of this is happening while your blood sugar looks perfect on paper. This is why so many people are shocked when they suddenly get diagnosed with type 2 diabetes. It didn't happen suddenly. It's been building for years. They just didn't know what signs to look for. Let me break down what insulin actually does in your body, because understanding this will help everything else make sense. Insulin's primary job is to regulate blood sugar, yes, but it does so much more than that. Insulin is your body's master storage hormone. When insulin is elevated, your body is in storage mode. You're storing fat, you're holding on to water and sodium, you're building and growing tissue. When insulin is low, your body is in burning mode. You're breaking down fat for energy. You're getting rid of excess fluid. You're in a catabolic state, where your body can clean up and repair damaged cells. In a metabolically healthy person, insulin rises after meals when you eat carbohydrates, does its job, and then comes back down. You spend part of your day in storage mode and part of your day in burning mode. This is normal and healthy. But when you have insulin resistance, your insulin levels are chronically elevated, even when you haven't eaten. You're stuck in storage mode all the time. Your body literally cannot access your fat stores for energy because insulin won't let it. This is why people with insulin resistance struggle so much with weight loss. It's not about willpower. It's not about calories. Your hormones won't allow you to burn fat. Insulin also affects almost every other system in your body. It influences your sex hormones like testosterone and estrogen. High insulin in women leads to polycystic ovary syndrome, irregular periods, infertility, and excess facial hair. High insulin in men lowers testosterone, leading to low energy, poor muscle mass, and sexual dysfunction. Insulin affects your stress hormones. It interferes with cortisol regulation, which impacts your sleep, your mood, and your ability to handle stress. Insulin affects your hunger hormones. When insulin is chronically high, it disrupts leptin signaling, which is the hormone that tells your brain you're full. This is why people with insulin resistance are always hungry, even right after eating a meal. Insulin also directly damages your blood vessels. High insulin levels cause your endothelial cells, the lining of your blood vessels, to become dysfunctional. This leads to high blood pressure, atherosclerosis, and increased risk of heart attack and stroke. Insulin promotes inflammation throughout your body. Chronic inflammation is at the root of virtually every chronic disease, from arthritis to Alzheimer's to autoimmune conditions. And insulin affects your brain. There's a reason Alzheimer's disease is now being called type 3 diabetes. Insulin resistance in the brain impairs your ability to use glucose for energy, leading to cognitive decline, brain fog, and eventually dementia. So when I tell you that insulin resistance is one of the most dangerous metabolic conditions you can have, I'm not exaggerating. It's not just about blood sugar. It's about your entire body's ability to function properly. And the scary part is that most people have no idea they have it until it's already caused significant damage. That's why recognizing these 13 red flags is so critical. These are your body's way of telling you that something is wrong, that your insulin levels are too high, that you need to make changes before it progresses to full-blown diabetes or worse. Let's go through these red flags one by one. And I want you to honestly assess how many of these apply to you. The more you have, the more likely it is that insulin resistance is already a problem for you. Red flag number 1 is fatigue, especially after meals. If you eat lunch and you want to take a nap an hour later, that's not normal. That's a sign that your body is struggling to handle the glucose load you just gave it. Your insulin is spiking high, your blood sugar is crashing, and you feel exhausted. In a metabolically healthy person, food gives you energy. In someone with insulin resistance, food makes you tired because your body is working so hard to process it. Red flag number 2 is constant hunger and cravings, especially for carbs and sugar. If you eat a meal and you're hungry again 2 hours later, that's insulin resistance. If you're constantly thinking about food, constantly snacking, constantly craving something sweet or starchy, that's insulin resistance. Your cells aren't getting the energy they need because insulin resistance is blocking glucose from entering them, so your brain thinks you're starving and makes you want to eat more. But eating more carbs just makes the problem worse. Red flag number 3 is weight gain, especially around your midsection. If you have a big belly, but relatively normal arms and legs, that's visceral fat, and it's directly caused by high insulin. Insulin tells your body to store fat, and when insulin is chronically elevated, you store fat preferentially around your organs. This creates that apple-shaped body type. And once that visceral fat is there, it's incredibly difficult to lose because you have to lower your insulin first, which requires changing your diet in ways most people aren't willing to do. Red flag number 4 is inability to lose weight, even with diet and exercise. This is the most frustrating one for people. You're eating less, you're working out more, and the scale won't budge. Or maybe you lose a few pounds and then plateau immediately. This is insulin resistance. As long as your insulin is high, your body cannot effectively burn fat for energy. You can starve yourself and exercise for hours, but if your insulin is elevated, you're fighting a losing battle. This is why calorie counting doesn't work for most people. It's not about calories. It's about hormones. Red flag number 5 is brain fog and difficulty concentrating. If you feel like your brain is in a fog, if you can't focus, if you walk into a room and forget why you're there, if you struggle to find words or follow conversations, that's a sign that your brain isn't getting the energy it needs. Insulin resistance affects your brain's ability to use glucose efficiently. Your brain cells become insulin resistant, just like your muscle and fat cells do. This impacts memory, concentration, and cognitive function. And if you don't address it, it can progress to more serious cognitive decline later in life. Red flag number 6 is high blood pressure. We talked about this in the last video, but it's worth repeating. High insulin causes your kidneys to retain sodium and water, which increases blood volume and pressure. High insulin also activates your sympathetic nervous system, which constricts your blood vessels. And high insulin damages your endothelium, reducing nitric oxide production and making your vessels stiff. If you have high blood pressure, especially if you're relatively young or not overweight, insulin resistance is almost certainly part of the picture. Red flag number 7 is skin changes. There are several skin manifestations of insulin resistance. The most common is acanthosis nigricans, which is dark, velvety patches of skin, usually in the folds of your neck, armpits, or groin. This is literally your skin cells responding to high insulin by growing and producing more pigment. Another sign is skin tags, those little flesh-colored growths that pop up on your neck, armpits, or eyelids. These are caused by high insulin, stimulating skin cell growth. And persistent acne, especially in adults, is often driven by insulin and the hormonal imbalances it causes. Red flag number 8 is irregular periods or fertility issues in women. High insulin disrupts the entire hormonal axis. It causes your ovaries to produce too much testosterone, which interferes with normal ovulation. This leads to irregular or absent periods, difficulty getting pregnant, and polycystic ovary syndrome. If you're a woman struggling with hormonal issues, insulin resistance should be the first thing you investigate, not the last. Yet most doctors will put you on birth control pills to regulate your cycle without ever addressing the underlying insulin problem. Red flag number 9 is low testosterone or erectile dysfunction in men. Just like insulin disrupts female hormones, it also disrupts male hormones. High insulin increases the conversion of testosterone to estrogen. It also increases sex hormone binding globulin, which binds up your free testosterone and makes it unavailable. The result is low testosterone symptoms like fatigue, poor muscle mass, decreased libido, and erectile dysfunction. If you're a man dealing with these issues, especially if you're under 50, insulin resistance is probably playing a major role. Red flag number 10 is fatty liver disease. Your liver is one of the first organs affected by insulin resistance. When your cells can't take in any more glucose, your liver converts that excess glucose to fat through a process called de novo lipogenesis. That fat gets stored in your liver cells, causing fatty liver disease. This used to be primarily a disease of alcoholics, but now we're seeing it in children, teenagers, and young adults who don't drink at all. It's being caused by sugar and refined carbohydrates, leading to insulin resistance and fat accumulation in the liver. Red flag number 11 is elevated triglycerides and low HDL cholesterol. When you look at a standard lipid panel, most doctors focus on total cholesterol and LDL cholesterol. But if you want to know if someone has insulin resistance, look at their triglycerides and HDL. High triglycerides, anything over 150, and low HDL, anything under 40 for men or 50 for women, is a clear sign of insulin resistance and metabolic dysfunction. The ratio of triglycerides to HDL is actually one of the best predictors of heart disease risk, better than LDL cholesterol. Red flag number 12 is gout or high uric acid. Insulin resistance impairs your kidney's ability to excrete uric acid. Uric acid builds up in your blood and can crystallize in your joints, causing gout, which is incredibly painful. High uric acid is also an independent risk factor for heart disease and kidney disease. If you have gout, or your doctor tells you your uric acid is elevated, insulin resistance is almost certainly present. Red flag number 13 is frequent urination and excessive thirst. Now this one is interesting because these are classic symptoms of diabetes when blood sugar is very high. But some people with insulin resistance experience these symptoms even when their blood sugar is technically normal. This happens because high insulin affects your kidney's ability to concentrate urine. You end up peeing more, which makes you thirsty, so you drink more, which makes you pee more. It's a cycle. If you're getting up multiple times per night to urinate, or you're constantly thirsty, that's a warning sign. Now here's what I want you to understand. You don't need to have all 13 of these red flags to have insulin resistance. If you have even 3 or 4 of them, insulin resistance is likely already a problem for you. And the more of these you have, the more advanced your insulin resistance probably is. This isn't meant to scare you. It's meant to wake you up to what's happening in your body so you can do something about it before it progresses further. The good news, and I really want to emphasize this, is that insulin resistance is reversible. It's not a life sentence. It's not a permanent condition. Your cells can become sensitive to insulin again if you give them the right environment. But you have to change the inputs. You can't keep doing the same things that caused the insulin resistance in the first place and expect it to get better. That would be like trying to heal a broken bone while continuing to hit it with a hammer every day. So let's talk about what actually causes insulin resistance. Because if you understand the cause, the solution becomes obvious. The primary driver of insulin resistance is chronic exposure to high levels of insulin. And what causes high insulin? Eating too many carbohydrates, especially refined carbohydrates and sugar, too frequently throughout the day. Every time you eat carbs, your insulin goes up. If you're eating carbs at every meal and snacking on carbs between meals, your insulin is elevated pretty much all day long. Your cells are constantly being told to take in more glucose. Eventually, they stop responding. They downregulate their insulin receptors because they're overwhelmed. Think of it like someone shouting at you constantly. At first, you pay attention. But after hours and days of non-stop shouting, you tune it out. You become desensitized to it. That's what your cells do with insulin. The solution is to stop shouting. You need to lower your insulin levels and keep them low for extended periods so your cells can become sensitive again. This means eating fewer carbohydrates, eating less frequently, and giving your body time in between meals when insulin is low. The other major contributor to insulin resistance is chronic inflammation and oxidative stress. When your body is inflamed, it interferes with insulin signaling at the cellular level. And what causes inflammation? Processed foods, industrial seed oils, excess sugar, chronic stress, poor sleep, environmental toxins, gut dysfunction, and lack of physical activity. All of these things create a pro-inflammatory state in your body that makes insulin resistance worse. Excess body fat, especially visceral fat, also drives insulin resistance. Fat tissue isn't just passive storage, it's metabolically active. It produces inflammatory molecules called cytokines that interfere with insulin signaling. This creates a vicious cycle. Insulin resistance causes you to store more fat. More fat causes more insulin resistance. This is why losing weight when you have insulin resistance is so difficult. You have to break the cycle by lowering insulin first, which then allows you to start burning fat, which then improves insulin sensitivity further. Lack of physical activity is another factor. Your muscles are supposed to be major consumers of glucose. When you exercise, your muscles pull glucose out of your bloodstream without even needing insulin. This helps keep your blood sugar and insulin levels lower. But when you're sedentary, your muscles aren't using much glucose. It stays in your bloodstream, insulin stays elevated, and resistance develops. This doesn't mean you have to become a gym rat. Even regular walking makes a huge difference in insulin sensitivity. Poor sleep also contributes significantly to insulin resistance. When you don't sleep enough or your sleep quality is poor, your stress hormones stay elevated. Your insulin sensitivity decreases, your appetite hormones get disrupted, and you crave more carbs and sugar the next day. Studies have shown that even a single night of poor sleep can impair insulin sensitivity. Chronic sleep deprivation is essentially giving yourself metabolic disease. Chronic stress is another huge factor. When you're stressed, your body releases cortisol and adrenaline. These hormones raise your blood sugar to give you energy to deal with the perceived threat. That causes insulin to go up. Chronic stress means chronically elevated cortisol and insulin, which promotes insulin resistance. And stress also makes you crave comfort foods, which are usually high in carbs and sugar, which makes everything worse. So the solution to insulin resistance isn't complicated, but it does require commitment. You need to address the root causes. You need to lower your insulin levels by changing your diet. You need to reduce inflammation. You need to move your body. You need to sleep well. You need to manage stress. These aren't separate issues. They're all connected. And when you address them together, the results can be dramatic and happen much faster than you might think. Let me give you a step-by-step action plan for reversing insulin resistance. These are the same steps I give to everyone I work with, and they work incredibly well if you actually implement them consistently. Step 1 is dramatically reduce your carbohydrate intake, especially refined carbs and sugar. This is non-negotiable. You cannot reverse insulin resistance while continuing to eat a high-carb diet. It's physiologically impossible. Your insulin will stay elevated. Your cells will stay resistant. You need to cut out sugar, bread, pasta, rice, cereal, crackers, chips, baked goods, candy, soda, juice, and anything made with flour. I know that sounds extreme. I know you're thinking you could never give up all those foods. But here's the thing. You don't have to give them up forever. You need to give them up temporarily while your body heals. Focus your diet on protein and non-starchy vegetables. Meat, fish, chicken, eggs, leafy greens, broccoli, cauliflower, peppers, mushrooms, asparagus, zucchini. These foods don't spike your insulin. They provide the nutrients your body needs to heal. They keep you full and satisfied. Add healthy fats like olive oil, avocados, nuts, seeds, and fatty fish. These fats don't raise insulin, and they're essential for hormone production and reducing inflammation. How many carbs should you eat? For most people trying to reverse insulin resistance, I recommend staying under 50 grams of total carbs per day. Ideally under 30. That might sound scary, but it's actually not that difficult once you get the hang of it. Non-starchy vegetables have very few carbs. A huge plate of broccoli and spinach might only have 10 grams of carbs. You can eat a lot of food and stay in that range as long as you're avoiding the high-carb foods. Step 2 is practice time-restricted eating or intermittent fasting. Remember, you want to give your body extended periods where insulin is low, so your cells can become sensitive again. If you're eating every 2 to 3 hours, like most people do, your insulin never gets a chance to come down. Instead, compress your eating into a shorter window. Start with 12 hours of fasting overnight. Finish dinner by 7 p.m. and don't eat again until 7 a.m. That's 12 hours of fasting while you sleep. Easy. As you get more comfortable, extend that window. Maybe you eat your first meal at 10 a.m. and finish by 6 p.m. That's an 8-hour eating window and a 16-hour fast. During the fasting period, you're only drinking water, black coffee, or plain tea. No calories. This allows your insulin to drop to baseline. Your body can start burning fat. Your cells can start recovering their insulin sensitivity. Don't worry, you won't be hungry. Once your body adapts to burning fat for fuel instead of constantly needing carbs, your hunger naturally decreases. Step 3 is prioritize protein at every meal. Protein is crucial for maintaining muscle mass, especially when you're reducing carbs and losing weight. Muscle is metabolically active tissue that helps improve insulin sensitivity. If you lose muscle, your metabolism slows down and insulin resistance gets worse. Aim for at least 30 grams of protein per meal, more if you're active or trying to build muscle. Good sources are meat, poultry, fish, eggs, and Greek yogurt. Protein also keeps you full and satisfied, which makes it easier to avoid snacking and stick to your eating window. Step 4 is add resistance training to your routine. You want to build or maintain muscle mass because muscle is a major sink for glucose. The more muscle you have and the more you use it, the better your insulin sensitivity. You don't need to lift heavy weights for hours. 2 to 3 sessions per week of basic strength training exercises like squats, push-ups, rows, and presses is enough. Even bodyweight exercises at home work great. The key is progressive overload, gradually challenging your muscles over time. Also, include regular walking. Walking after meals is particularly powerful for improving insulin sensitivity. When you walk, your muscles pull glucose out of your bloodstream without needing insulin. This blunts the blood sugar and insulin spike from your meal. Even just a 15 to 20-minute walk after dinner can make a significant difference in your insulin levels and overall metabolic health. Step 5 is prioritize sleep. You need 7 to 8 hours of quality sleep every night. Make your room dark, cool, and quiet. Get off screens at least an hour before bed because the blue light suppresses melatonin. Avoid caffeine after noon. Avoid alcohol close to bedtime. Establish a consistent sleep schedule, going to bed and waking up at the same time every day. If you're not sleeping well, address it. Get blackout curtains. Use a white noise machine. Try magnesium glycinate before bed. Whatever it takes. Sleep is not optional if you want to reverse insulin resistance. Step 6 is manage your stress. This is easier said than done, I know. But you have to find ways to activate your parasympathetic nervous system and lower cortisol. That might be meditation, deep breathing exercises, yoga, spending time in nature, journaling, connecting with loved ones, or hobbies that relax you. Even just 10 minutes a day of intentional stress management can significantly impact your cortisol and insulin levels. And sometimes, stress management means setting boundaries, saying no to commitments that drain you, and protecting your time and energy. Step 7 is supplement strategically. While diet and lifestyle are the foundation, certain supplements can accelerate your progress. Magnesium is huge because most people are deficient, and it's essential for insulin signaling. Take 300 to 400 milligrams of magnesium glycinate daily. Berberine is a plant compound that improves insulin sensitivity and can lower blood sugar as effectively as metformin in some studies. Typical dose is 500 milligrams, 2 to 3 times per day with meals. Alpha-lipoic acid is an antioxidant that enhances insulin sensitivity and helps protect against diabetic complications. Chromium picolinate helps improve insulin function. Omega-3 fish oil reduces inflammation, which is critical for improving insulin sensitivity. And vitamin D, if you're deficient, which many people are, especially in winter. Low vitamin D is associated with insulin resistance, and supplementing can help improve it. Now, let me tell you what to expect when you start implementing these changes. The first few days to a week can be challenging. If you've been eating a high-carb diet, you're going to experience carb withdrawal. You might feel tired, irritable, foggy, maybe even get headaches. This is normal. This is your body transitioning from burning primarily glucose to burning more fat for fuel. It's temporary. Stay hydrated, make sure you're getting enough salt, and power through. It gets better. After about a week, you'll start feeling noticeably better. Your energy will stabilize. You won't have those afternoon crashes. Your hunger and cravings will decrease dramatically. Your brain fog will start lifting. You'll probably notice you're sleeping better. And if you check your blood pressure, it's likely already starting to come down. These early wins are incredibly motivating. Within a few weeks, you'll see more significant changes. Weight loss, especially around your midsection. Improved mood and mental clarity. Better skin. Less inflammation and joint pain if you had any. More stable energy throughout the day. Reduced hunger. Your clothes fitting better. If you get labs done, you'll likely see your triglycerides dropping and your HDL increasing, which are clear markers of improving insulin sensitivity. Within a few months, if you're consistent, you can reverse insulin resistance completely in many cases. Your fasting insulin will come down to healthy levels. Your insulin sensitivity will improve dramatically. You'll have lost significant weight if you needed to. Your blood pressure, if it was high, will likely be normal. Your energy, sleep, and mood will be the best they've been in years. And your risk for all those chronic diseases we talked about earlier will be drastically reduced. But here's the critical part. You have to stay consistent. Insulin resistance didn't develop overnight, and it won't be permanently fixed overnight. This isn't a diet you do for a few weeks and then go back to your old habits. This is a lifestyle change. Now, that doesn't mean you can never have a piece of birthday cake or enjoy pizza with friends. Once your insulin sensitivity is restored, you have more flexibility. But the foundation of your diet needs to remain low in refined carbs and sugar, high in whole foods, protein, and vegetables. Think of it like this. If you have a shoulder injury, you do physical therapy to heal it. But once it's healed, you don't go back to doing the exact same movements that injured it in the first place. You've learned how to move properly to protect that shoulder. It's the same with insulin resistance. You're healing your metabolism. But once it's healed, you need to maintain those healthy habits to keep it healed. I want to address some common concerns and questions people have. What if you're already diabetic? Can you still reverse insulin resistance? Yes, in many cases, you can. Type 2 diabetes is essentially advanced insulin resistance, where your pancreas can no longer produce enough insulin to overcome the resistance. But if you address the insulin resistance through the steps we discussed, you can often reverse the diabetes. Your pancreas, once it's not being overworked constantly, can recover. Your cells can become sensitive to insulin again. I've seen people come off insulin injections and all their diabetes medications by fixing their diet and lifestyle. It's absolutely possible. What if you're lean and you don't have weight to lose? Can you still have insulin resistance? Yes. You can absolutely be thin and insulin resistant. It's called metabolically obese normal weight. You don't have excess body fat, but you have the same metabolic dysfunction as someone who's overweight. This often happens in people who eat a poor diet but have genetics that don't predispose them to store a lot of fat. The damage is still happening internally. You might have fatty liver disease, high triglycerides, inflammation, and all the other problems of insulin resistance, without the visible weight gain. If you have several of the red flags we discussed, you need to address it regardless of your weight. What about genetic factors? What if diabetes runs in your family? Genetics do play a role, but they're not destiny. If you have a family history of diabetes, it means you're more susceptible to developing insulin resistance if you eat a high-carb diet and live an unhealthy lifestyle. But it doesn't mean you're doomed. In fact, it means you need to be even more careful about your diet and lifestyle. The good news is that dietary and lifestyle factors are far more important than genetics in determining whether you actually develop diabetes. You have control over this. How quickly will you see results? This varies depending on how advanced your insulin resistance is and how strictly you follow the recommendations. Some people feel dramatically better within days. For others, it takes weeks or months to see significant improvement. But everyone who consistently implements these changes will see improvement. Your body wants to heal. You just have to give it the right environment to do so. Can you do this if you're vegetarian or vegan? It's more challenging but possible. The key is getting enough protein from plant sources like legumes, tofu, tempeh, and plant-based protein powders. You also need to be careful with carbs because many plant-based diets are very high in carbs. Focus on low-carb vegetables, nuts, seeds, avocados, and moderate amounts of legumes. You'll probably need to supplement with B12, omega-3s, and possibly other nutrients that are harder to get from plants. What if you can't afford organic grass-fed everything? Don't let perfect be the enemy of good. Conventional eggs, chicken, and ground beef are still far better for you than processed carbs and sugar. Frozen vegetables are just as nutritious as fresh and often cheaper. Do the best you can with what you have. The most important changes are cutting out sugar and refined carbs and eating more whole foods. Those changes don't have to be expensive. Let me also talk about monitoring your progress. Obviously, how you feel is important, but it's also helpful to have objective data. If you can, ask your doctor to check your fasting insulin. This is not a standard test, so you'll have to specifically request it. A healthy fasting insulin is under 10, ideally under 5. If it's 15 or 20 or higher, that's clear evidence of insulin resistance. You can also check hemoglobin A1C, which shows your average blood sugar over 3 months. Under 5.7 is normal. 5.7 to 6.4 is pre-diabetes. Above 6.5 is diabetes. A lipid panel showing your triglycerides, HDL and LDL is also valuable. Look at the triglyceride to HDL ratio. Divide your triglycerides by your HDL. If the ratio is under 2, that's good. Over 3 is concerning for insulin resistance. You can also measure your waist circumference. Men should be under 40 inches, women under 35 inches. If you're above that, you likely have excess visceral fat from insulin resistance. Some people like to use a continuous glucose monitor to see how different foods affect their blood sugar in real time. This can be eye-opening and help you understand which foods spike your blood sugar and which don't. But it's not necessary. If you follow the dietary guidelines we discussed, your blood sugar will naturally stabilize without needing to monitor it constantly. I want to give you one more piece of encouragement. I know this all seems overwhelming. You're probably looking at this list of changes and thinking there's no way you can do all of it. But you don't have to do everything perfectly starting tomorrow. Pick 1 or 2 things to start with. Maybe you cut out soda and start walking after dinner. Just those 2 changes will start improving your insulin sensitivity. Then add another change, then another. Build momentum gradually. And remember, every single meal is an opportunity to make a better choice. If you have a meal that's high in carbs and spikes your insulin, don't throw in the towel and say the day is ruined. Just make the next meal better. One meal doesn't define your health. It's what you do consistently, over time, that matters. Progress, not perfection. You're also not alone in this. Millions of people are dealing with insulin resistance. It's probably the most common metabolic disorder in the modern world. The problem is most people don't know they have it and don't know what to do about it. But now you do. You know the red flags. You know the underlying mechanisms. You know what changes to make. You have everything you need to take control of this. The last thing I'll say is this. Your body is incredibly resilient. It has an amazing capacity to heal when you give it what it needs. Insulin resistance is serious, and it causes real damage, but it's not permanent. It's not a life sentence. You can reverse this. You can restore your metabolic health. You can prevent diabetes and all the complications that come with it. You can feel better than you felt in years, but you have to act. You have to make the changes. Nobody can do it for you. If you found this video helpful and you want to dive deeper into metabolic health, make sure you check out my video on lowering blood pressure naturally, because so much of what we talked about there overlaps with reversing insulin resistance. These conditions are connected, and addressing one helps address the other. Thanks guys for watching, and I'll see you in the next one.